Welcome to today's emergency meeting of the Schiller Institute entitled Omicron Urgent Need for a World Health System. Since March of 2020, Helga Sepp-LaRouche and the Schiller Institute, but through the Committee for the Coincidence of Opposites, have emphasized that only a singular worldwide approach to addressing the question of not merely the coronavirus, but the underlying conditions, the underlying economic conditions, and the underlying cultural conditions that led to that crisis would work. With the recent announcements from South Africa of a new strain of the coronavirus, this has been underscored. And today's meeting was called on an emergency basis for the purpose not merely of addressing the new variant, but addressing the idea that perhaps now the world would listen to the words of Helga Sepp-LaRouche and of the committee in calling for such an idea. A statement was issued by Dr. Jocelyn Elders, former Surgeon General of the United States, from whom we'll hear a little later, pertaining to this. And to this statement, many people have begun to respond. In specific, one element that the Schiller Institute has added to this idea over the past days and weeks has been something called Operation Ibn Sina. It was a way of addressing the crisis in Afghanistan, which was a crisis not merely of a disease of one type or another, but multiply connected diseases of famine, of war, and of the coronavirus itself. These are the diseases of an adolescent mankind that have to be, at this point, overcome by means of cooperation among nations, nations that may think of themselves as being adversaries, but are all part of a single human species and are all interwoven in a singular garment of destiny, as Martin Luther King once said. That Operation Ibn Sina referred to a particular physician, a great genius of the 10th century, who comes from the area of Afghanistan and Southwest Asia, an author of over 450 works, about 250 of which now survive, and basically the father of modern medicine. I'd like to just quote something from one of Ibn Sina's writings. He said, "From the depth of the black earth up to Saturn's apogee, all the problems of the universe have been solved by me. I have escaped from the coils of snares and deceits. I have unraveled all knots except the knot of death." So that the concept of medicine was not merely one that dealt with particular individuated diseases, but was a concept of mental health and physical health as a whole. Back 20 years ago, during the period of the anthrax attacks of 9/11, Lyndon LaRouche authored a document called A National Program Against Germ Warfare. What we're going to do is to play now a few excerpts from that document just to put into context the over 2-decade process of deliberation and of action that the Schiller Institute has been characterized by, and which we now hope will become what the world becomes characterized by.
The most important principles of national defense against bacteriological and related forms of warfare were consolidated as knowledge in the experience of World War II and the war in Korea. Those lessons were featured in the adoption and implementation of the Hill-Burton legislation adopted shortly after the close of World War II. National biological defense means chiefly those measures of sanitation which are essential to improving and defending the life expectancies and well-being of the population as a whole. This includes those measures and institutionalized practices which modern society has come to consider public sanitation. This includes not only safe water, but also improved supplies of energy per capita and per square kilometer. This at declining relative costs to communities, industries, and the general public. It includes improved public transportation. It also includes the practice of the medical professions generally. The pivotal feature of the medical profession's role is the general hospital, provided as a public institution which is not only a teaching institution, but which serves those sections of the population which are relatively indigent and are therefore the most likely radiators of infectious diseases. The public teaching hospital of this type which is also integrated with the teaching and research functions of a university, is among the most valuable such facilities. The feature of modern practice to be emphasized in dealing with the actuality and threats of biological warfare, as now, is the ability of the medical profession to respond effectively by producing rapidly appropriate forms of non-standard treatment for diseases of a non-standard quality. However, without lessening emphasis on the importance of medical counterintelligence practice, it is public sanitation which remains the first line of defense of the population against both normal epidemic disease and also biological warfare attacks. We require a coordinated crash program sort of attack on both fronts combined. This means that we must move quickly not only to restore the indispensable Washington, D.C. General Hospital, but to restore those medical and infrastructural defenses which were taken down piece by piece during the approximate quarter century since the enactment of the original Health Maintenance Organization legislation. If we do not do that, whatever might happen to you and your family as a result of biological warfare attacks should be considered now as virtually a done deal. Fortunately, senior figures with inside knowledge of former national crash programs, such as the Manhattan Project and NASA, are invaluable advisors on such topics as don't make the mistakes we made issues, especially in coordination among military specialists, scientists, and the general bureaucratic, legislative, and lobbying influences which are most prone to ruin the implementation of what had been excellent missions. Science, economics-driven policy making for application of science, and military precision of deployment must be integrated into a single mission orientation, and this must be backed with a general whatever it takes directive from the president himself.
So the present crisis has actually been decades in the making. And yes, while there are particular innovations and changes with the coronavirus, the problem is that there was not a sufficient change in the orientation of the United States, the transatlantic world, and the world as a whole to working together to solve the great problems of famine, of disease, and of war as a whole. There are nations that are committed to that, and there are nations that are dragging their feet. The important point is that the people of those nations are dying regardless. Clean water, nutritious food, adequate energy, these are the things that must accompany vaccine programs or any other medical programs. And this is something that we are here to emphasize today from the standpoint of initiating a dialogue or calling for a worldwide dialogue involving epidemiologists, virologists, and the general citizens to step back from the panic, step back from the pessimism, step back from the hostility and the animosity, to engage in a considered dialogue where new ideas are sorely needed at a time when mistakes will in fact be made, both in the way of treatment, of objections to various forms of treatment, but this should not be and cannot be the focus. There has to be a focus on one world coming together to describe, and to engage in this kind of dialogue. To begin today and to emphasize this process as it should be emphasized and thought about, we're beginning with the chairman and founder of the Schiller Institute, Helga Seppler-Bruch. Helga?
Yes, hello. Well, I think after 2 years of the pandemic, it's almost 2 years where the COVID-19 was discovered, it is time to review what we learned and what mistakes were made and what needs to be urgently done to get the pandemic under control, because it is not under control. In Germany, we have now the fourth wave, which in a certain sense probably could have been avoided, or it could have been much less of a fourth wave, because all the warning signs were there in the summer. Virologists, epidemiologists basically told the politicians that unless certain measures were taken, this would occur. And basically, we are now at the point in Germany where in several states there is discussion about triage. Now, triage is something which should only occur in the case of an unavoidable natural disaster or under wartime condition, but not in the fourth largest economy of the world. In France, we are even talking about the fifth wave, and it is very clear that we could see a breakdown of the health system, because this is what some people from the medical profession are warning about. We have now, after the peak in the last year, about 5,000 hospital beds less. We have 1/3 of the medical personnel, which either has left already or is about to leave, simply because they are at the breakdown point. They are physically exhausted, and they have not gotten any, compensation for their enormous work they have sacrificed. So we absolutely are at a point, where we urgently need to restart. I wrote an article in March 2020, beginning of March, where I said this is a pandemic, and the only way how we will get out of this pandemic is that we create a modern health system in every single country, because it was very clear, that you would not solve the problem in the so-called rich countries when the virus could, move around freely in the developing countries. But after 2 years, what is the situation? We have now, I think, the 10 richest countries have gotten about 60% of the vaccination doses, while Africa, for example, has only 7% of its population vaccinated. And while it is probably too early to say much about this newest mutation, the Omicron, it seems much more infectious. It is not yet clear if it's more lethal than the Delta variant. But in any case, this is the time bomb, which is, there for everybody, because if we do not provide every country with a modern health system, not just the vaccination, then you can have areas where there is very little vaccination occurring, where viruses mutate for quite some long time, and they could eventually reach a point where they make the vaccines which already have been applied obsolete. And then various pharmaceutical firms have said they could develop a new vaccine in 3 weeks for such an occasion. But then it would take 3 months testing and 3 months production. So you would have half a year before the new vaccines could be applied. And you could have an enormous catastrophe in the meantime. Now, why is it that, for example, we have now more than 5,000 people who died of COVID-related diseases? Why is it that the United States had more than 750,000 deaths, with a population a little bit more than 300 million? Germany, with a population of roughly 80 million, had more than 100,000 deaths. But China, with a population of 1.3 billion people, so far had not even 5,000 people death. I mean, there is a clear lesson. And, in a certain sense, if the West is not willing to look at what China did well, and, reflects on the causes of why the mistakes were made in Europe, for example, or in the United States, I don't think this will be remedied. What they did in China, they immediately applied all the known standard measures for a pandemic. Isolation, quarantine, and basically they locked down an entire province, Hubei, and the city of Wuhan, with 11 million people, locked it down for 2 months, applied all strict measures, and then afterwards had a system of absolute rigorous contact tracing, digital contact tracing, and isolation immediately when a new case somewhere was spotted. Now, the argument was always that, China is a very, dirigist country, and you can't do that in the so-called liberal societies. But, in Germany, a lot of mistakes were made. I mean, first of all, the health minister said in the beginning that the virus would never come to Germany, which was a so nonsensical statement that it's hard to believe. Then there were no masks. Then the vaccines were ordered too late. Then, back and forth, no coordination, even within one country. So a lot of the trust in the population was lost, and a lot of, people died for reasons which could have been avoided. And I think we have to now really review the situation and recognize that this disease could be with us, and new diseases could erupt any moment. I mean, there are some virologists already studying the possibility of other viruses spreading and becoming a pandemic. So it is high time that we really do the kinds of measures which should have been done from the very beginning. And I think it is now dawning on people that unless we eliminate the susceptibility of entire continents to be sort of the petri dish for the spread of variants and mutations of the virus, that this will not be brought under control. Now, what that means is we have to have, first of all, I think in Europe and in the United States, we should draw the lesson of the fact that the privatization of the health system was a big mistake, because healthcare is one of the areas where, the common good should be upfront and not profit maximization. And, that is simply, like education, like basic infrastructure. These are areas which belong in the domain of the state. Now, that can be discussed, but I think, if we want to become more efficient in providing for the common good of the people, then that's what needs to be done. Now, if you look at the developing countries, the worst case right now are obviously Haiti and Afghanistan. I could name Syria and Yemen and some other countries, but let's stick to Afghanistan for the moment. I mean, this is a country which, after 20 years of NATO war, basically it turned out 2 weeks later that the country is in absolute shambles. They have more than 90% of the people food insecure, which means that many millions could die this coming winter. And more than 90% of the people have no medical supply whatsoever. And, that obviously is a situation in the middle of a pandemic, which is absolutely untenable. So therefore, we have proposed to start there with a modern health system, meaning to build modern hospitals. China has proven in Wuhan that you can build a modern hospital in 2 weeks with 1,000 beds. We could prefabricate such hospitals in the industrialized countries and ship them to developing countries like Afghanistan, build them up quickly. But then you need basic infrastructure. You need electricity. You need clean water. There are 2 billion people in the world who have no access to clean water. That needs to be urgently gotten underway. Then for that, all you need about 200 gigawatt stable, secure electricity supply. And naturally, all of this requires then basic building of basic infrastructure. So in a certain sense, if we understand that this pandemic has taught us a lesson, that we are one world community, one mankind, we should start to build these modern hospitals in every country and take that as the beginning of overcoming the underdevelopment, which is basically the reason why this pandemic could rage in the way it did. Now that means we need about 30,000 new hospitals worldwide. We need about 10 million new hospital beds in these hospitals. We need about millions of new doctors and nurses and health workers. This should immediately start with a training program, especially for young people who should be given the mission to help to educate the population. What is a pandemic? Why are basic sanitation measures necessary? And the training of these youth could be the beginning, of integrating them into an education program for this modern health system worldwide. Now, I think if we would do that, and start with a couple of countries, I mean, we should do it with all countries, and if all international forces would work together, including all major nations, if they would work together on this question of a global health system, we could immediately start to change the directionality. We could get the pandemic much better under control. And, obviously, there are many measures which should be taken as well, like lifting of the patents for the time being until the vaccine production is worldwide sufficient. But I think the key question is to recognize that the underdevelopment of entire continents, of billions of people, that this is not a natural condition of mankind, and that if we want to do something for humanity as a whole, we should start to overcome that underdevelopment. And the best way to do this is by building modern hospitals in every country, and do the programs which go with it, which altogether would require about 1.5 billion new jobs. Now, if you think that that is too much, the ILO has published figures, that in the pandemic in 2020 alone, 500 million jobs got lost, and that does not even account for the black economy. So 1.5 billion new productive jobs is not too little. Now, in the case of Afghanistan, and I think Dennis already referred to it, what is more obvious than to name this operation Ibn Sina? Ibn Sina, who lived from 980 to 1037, was a universal thinker of outstanding, quality. He belongs in the same rank like Plato, Confucius, Leibniz, and he not only was a universal thinker who developed the most profound philosophical conception, but he is most known for his unique contribution to the science of medicine. The most famous of his many books is the Canon of Medicine, which is a compilation of both the anatomy of the body, the connection between the muscle and nerve system. He discovered many new diseases, completely revolutionary at his time. He developed the whole catalog of medicines, and his books were the standard in part until the 19th century in Europe. And he is obviously one of those unique thinkers which belong to the best tradition of the people from which he comes. In this case, there's a certain debate: does he belong to the Uzbeks, to the Afghanis, or to the Iranians? It does not really matter, because he comes from this region, and maybe only his father was born in Afghanistan and he in Uzbekistan. But that is really a detail which is not relevant to the argument I'm making. What I'm saying is that a nation like Afghanistan, which is now completely destroyed after 40 years of war, which is in mortal danger of losing millions of people, it must have a synonym for the proudest and most beautiful tradition when a son of this people contributed to universal knowledge. And, from the responses we have gotten so far from many people from the region, from, Yemen, from Syria, from Pakistan, Iran, Afghanistan itself, it is an idea which can give this effort a name which is inspiring and which promises a better future for the Afghani people altogether. So our proposal is that we rally forces around Operation Ibn Sina to, basically say we need to immediately address this situation by building a modern health system and make that the model for every developing country in the world. And that way we can also start to give the countries of the so-called advanced sector, which does not look so advanced most of the time, to give them a mission, because a lot of the ills which have befallen our society, like this enormous loss of trust between the people and the governments, which is a big phenomena in the United States and in many European countries, where the behavior of the governments in the pandemic has contributed to, that needs to be urgently remedied, and no better way of remedying than giving it a joint mission. Now, Dr. Elders, from whom you will hear momentarily, has written this letter to address this question because, despite the science about the virus, there are still an enormous enormous number of people who refuse to be vaccinated, who have all kinds of explanations of what is the intent of vaccination, which is, completely contrary to the science of it. And in Germany now, we see that, with the new rules, the so-called G2 rule and other such rules, there are now many, many people who, and maybe also under the impression of the Omicron mutation, who are vaccinating or allowed to be vaccinated for the first time. But there is still a portion of the population who absolutely believes that this is a conspiracy to kill them. And I don't even want to go through the various arguments, which mixes a lot of reality and interpretation, which makes it all wrong. So therefore, Dr. Elders has called on virologists around the world that they should join hands to make an education campaign to explain some very, very basic facts to the population, which was obviously not done by the governments in time. For example, what is the difference between a pandemic and an epidemic? What are the standard procedures in the case of a pandemic? How does the virus work? All of these questions, which most people really have not a clear understanding. And I think, should we have mandatory vaccination or not? This is a big debate now in Germany, where the tendency is going in the direction of a mandatory vaccination. Is that the right idea? What are the ethical questions involved? I think it is very important to engage the population into a competent dialogue, where the idea must be to rebuild the trust among the people. So I think, this is an urgent need. I think the principle, which I think must be put up front again, which I think has a lot to do with the oath of Hippocrates, with the medical honor, and that is that the human life has to be treated as absolutely unique. If you want to discuss it from the standpoint of religious belief, you can say every single human life must be regarded as sacred. And if you follow that principle, I think one can, and it is sacred and unique, because the human species is the only species in the universe endowed with creative reason. We are the only species which can discover again and again fundamental laws of the universe, which, when they are applied as scientific and technological progress in the production process, lead to an increase in the living standard, longevity, and an improvement of the conditions of life. And that is what we should be doing for the entire human species. So I think this image of man must be in the center of this discussion, and not some other consideration like profit or other ideas which people may have. So I want to leave it with that, with this appeal that after 2 years, we absolutely have to draw the lesson of what happened and really get serious about the building of a modern health system in every single country of the planet.
Thank you very much, Helga. I want to also point out to everybody that we will be having a question and answer period. If you just joined us, by the way, the conference is an emergency conference, Omicron, Urgent Need for a World Health System. You may have heard at the beginning of our webcast today a quote from Lyndon LaRouche, in which he referenced DC General Hospital and a battle that had gone on there 20 years ago to stop that hospital, which was a level 5 hospital, capable of dealing with everything, including biological warfare, was shut down. And many hospitals in the United States have been shut down, and all over the world have been shut down, not actually in all countries, but mainly in the countries of the transatlantic sector. But back 20 years ago, when that fight for DC General Hospital was going on, Jocelyn Elders, former Surgeon General under Bill Clinton, stepped in and worked with us at that time. It was a highly controversial circumstance. It was controversial for many different reasons. And for 20 years, for 2 decades, Dr. Elders has had the same message and maybe finally it'll be listened to. And she has written a statement, a letter. Some people have already responded to it. And it's always my honor to introduce her. And I believe what she's going to do is make you all aware of that statement. And during the questions and answers, we'll take up other matters. I should also here indicate that her colleague, David Satcher, former Surgeon General of the United States also, and who's also a member of our committee, sends his greetings to the conference. He was unable to be with us here today. So, Dr. Elders. Hello there.
Good morning.
Good morning.
We've heard of just a wonderful statement from Helga explaining what's been going on and the problems that we've been facing and the problems that you've seen and heard about. And I'm this morning, what I'm going to do is I'm going to review a part of the letter. Many of you've gotten the letter, but I'm going to review the part of the letter that that you've gotten. Some of it Helga has gone over with you already. And I'll just do a little bit of it, and then we'll have questions. And this was an open letter. Some of the virologists around the country have gotten them, I go and I say it's unfortunate, and it is. While the world is now, we're 20 months in a coronavirus pandemic, it is yet to adopt a unified educational and public informational campaign to educate all of the world's people as to what we must do. Pandemics do not respond to election cycles, declarations of war, stock market fluctuations, or media campaigns. They respond to vigorous, competent, relentless public health measures in combination with medical breakthroughs required to address the situation. Pandemics, by their virtue, cannot be defeated locally or regionally, but must be addressed globally with global cooperation and cooperation. All the different governments cannot go in their separate ways. We must address this as a global situation. And I think Helga has reviewed much of this and told you about many of the problems that are going on around the world. And each country must do this. But still, after 20 months of suffering, the ravages of COVID-19 pandemic is still with us. The world still does not have adequate, comprehensive, unified approach to solving the crop crisis. The lack of information or disinformation on the part of far too many people is contributing to an increasingly untenable situation. On behalf of the Committee for Coincidence of Opposites, I'm calling upon virologists and medical experts from throughout the globe to undertake an international, cooperative, and unified educational campaign to establish a sane approach to deal with this and potentially future pandemics. You know, we have all of this to do, and we've not done this. This campaign should include clear expositions of the following. And I think Helga has already mentioned it to you. We've got to have everybody know what is a pandemic. Not everybody knows what a pandemic is. If we have a pandemic, how must it be fought? What is public health? And how must we join forces to implement tried and tested public health measures, including sanitation, medicines, including vaccines to defeat this virus? Everybody must have an opportunity to have clean water, food, vaccines, and medications for defeating this virus. What is the comparative efficacy of the various vaccines and other measures now developed in different nations and regions in preventing serious illness and death? We need to work to make sure it's available for everybody. How do we provide adequate numbers of hospitals, health facilities, and medical personnel in every nation, including the systemic recruitment of youth community health workers to assist us now as the pandemic is brought under control? We've got to have everybody involved, not just some of us. 76 years ago, at the close of World War II, the world said never again to depraved indifference, which is the deadly virus that must be fought to prevent the uncontrolled spread of death and disease. The establishment of a modern healthcare system in every nation, including food, clean and safe water, electricity, decent housing, sanitation, roads, and other infrastructure that the world requires to address the ensemble of diseases we could now be facing. The world's healers must step in now to do the job that has not been done. Let's educate the people so that science must supersede superstition. Hope may conquer despair, and concern for all humanity overcome a self-destructive concern for just a selective few of humanity. I ask the worldwide medical community to join us in this effort to try and make a difference. We can make a difference. We have the resources. We have the know-how. And we've got to do what we need to do to get the job done. I feel that there's no question that if everybody joins in and do their share, or do the part that they can do. We don't need everybody to do everything, but we need everybody to do something. Do the things that you know how to do. Do the things that you can do. And with those of us who can do more, let us do more. And not worry about what somebody else has not done. We've got to do what we can do. And I think that our committee is about that. And that's why I'm asking virologists all over this nation, in every country, and asking every community leader, every public health department to join in this effort so we can try and make a difference. We've got to be smarter than this virus. I realize it's a very smart virus, but we need to overcome the efforts that this virus is putting out and supersede this virus to make a difference. And it's going to take all of us working very hard for a very long time to conquer it. And I think that we're trying, and hopefully we can all get involved and make a difference and not get involved in infighting. Some of us can provide food. Some can provide clean water. Some can provide shelter or other things. But we've got to do what we've got to do to make a difference. And I thank you.
We thank you also. He's getting the call. That's what happens for doctors. So thank you very much. And we'll get back to Dr. Elders for the discussion. We're now going to hear, as was already mentioned, this is an international conference. We want to welcome, by the way, people who are with us from particularly Europe and South and Central America, also from Africa. I don't know exactly who we have on from Asia. Time differences and all that. Our next speaker is Alessia Ruggeri. She's the chairwoman of UPI Italia, an association of small and medium-sized enterprises. She's a trade unionist in Sicily, and she responded virtually instantly to this letter and this appeal, and we're going to hear from her now.
I think that the Taliban are not the absolute evil for Afghanistan. On the contrary, the Taliban came to power because they had the support of the Afghan people. The Taliban are the rightful owners of their land and the only ones who managed to send the American invaders away. The former president of Afghanistan, Ashraf Ghani, ran away with a suitcase full of money, about $170 million. And this is a shame in a country where the people are starving. Afghanistan has been used as a production lab for opium, a money machine for the powerful, while the people have been starving. We are forgiven all those who fought against us. The war is over. We don't want any external or internal enemies. We will not allow anyone to use our country to export opium or to organize terrorist attacks. But to do so, we'll need international support to promote an alternative to poppy cultivation, the Taliban spokesman said. Yesterday, the Taliban have issued a new decree on the rights of Afghan women. Their consent will be necessary to contract marriage and will be forbidden to give a woman in exchange for an agreement. They will also introduce the right of widows to determine their own future, as well as the right to inheritance and to a fixed share of the properties of husbands, children, fathers, and relatives. While in Europe, especially in Italy, democracy dies, from free Afghanistan comes the first signal of a new rebirth for the recognition of human rights. I, as a spokeswoman of the Comitato della Repubblica, together with the Committee of Coincidence of Opposites, endorses Al Ghazala Rouge call for Operation IBM Sina in Afghanistan. I would like to thank the chairwoman of the Schiller Institute, Helga Zepp-LaRouche, and also the chairwoman of Molbisol, Liliana Gorini.
Yes, and I should just clarify that the statement she's referring to is the one that Helga put out, Operation Ibn Sina to save the Afghan people. We'll also be talking about that a little bit later. Now, the committee has been active for about 18 months, and in specific, in one area, Washington, D.C., where Walter Faget, who has been previously the former head of the D.C. Health Department, has been working particularly in the areas of Ward 7 and Ward 8, Southeast Washington. This is where there's a predominantly Black area, very, very low vaccination rates there originally starting back in February of this year. It's about 4%. The rate is at approximately 40% now, 70% for the city as a whole. Still low, still a disparity, but at least for the period of the past week, except perhaps yesterday, there were no deaths in the city of Washington from COVID. And what we're going to do here is play a short statement from him, and Dr. Faget will be with us later to talk about the ways in which the actions of the committee were made concrete in Washington. We hope that this will spur some others or inspire some others to doing the same thing in other cities around the country.
Well, greetings from the DMV. We really appreciate the Schiller Institute under Helga's leadership and Dr. Elders in terms of hosting this very timely conference on the need for a worldwide upgrade of healthcare delivery systems, especially in developing countries, to really stop the spread of the Omicron variant and COVID, the pandemic in general. We agree that the new variant is of concern in South Africa, which has a 29% immunization rate. And it's even more concerned in other parts of Africa with only 6%. And can you imagine if this had appeared in Guinea, Sierra Leone, and Liberia, where Ebola and Marburg virus have recently been identified? The 50 mutations in the COVID-19 virus combined with the Ebola and Marburg mutations could result in a devastating, lethal pandemic of catastrophic outcomes worldwide. And when you have that scenario combined with famine, dehydration, adverse climate in places like Mozambique, you have a very concerning situation. But it's we here in Washington now are really labs are sequencing positive samples to see in search of the Omicron. We've had no evidence of Omicron in the DMV as of today. As I said, we're at zero deaths as of today in DC, only 16 deaths in Maryland, 26 deaths in Virginia. We do have 55 new cases in DC, about 1,200 in Maryland, and 1,900 in Virginia. So we feel that we're on the downside, and we think the community health worker involvement has really been a real help. Dr. Elder's vision of brigades of youth helping out in the community, developing a whole cadre of trusted messengers has really been helpful to us. And it's even more helpful now as we try to clarify the guidance relative to how do we address this new threat of the Omicron virus, Omicron new mutation in COVID. We still know that Delta is the main concern here in our region. And we are able to reassure the community in the DMV that with all the tools we have now, to include the new antiviral, which was approved by FDA as of yesterday, pretty close vote, but it will be available for limited use. So the Merck antiviral molnupiravir will be probably of limited use in the 60 and over population, will will be contraindicated in the pregnant population. But we also, Pfizer has now developed a more effective antiviral, which will be probably available to the younger, under 60, and does not have as many safety concerns as with the Merck. But both these, in addition to the monoclonal antibodies, vaccines, and really, primarily, the most important thing is masking, social distancing, staying home when you're sick, washing your hands. Those preventive health measures do work. And though here in DC, the mayor has lifted the mandate for masking indoors, some businesses and schools are still masking. And with the Omicron concern now, more private businesses are thinking about going back to masking, but that will be their option. So we think there is cause concern, but again, we think that with some of the strategies and pilot projects that have been instituted by the Committee for the Incidence of Opposites, they really have benefits from a model now that we'd be very happy to share worldwide in terms of what works. And like as I said, here in Buffalo and other places, we are seeing some progress. So thanks again for including us in this conversation, and we are available for questions and answers. Thank you very much. Peace and blessings.
Thank you very much, Dr. Faget. Marcia Baker has been working on a particular area. The committee from the early part of this year, February, March, had selected the nation of Mozambique in Southern Africa for a particular project, a catalytic project, in which the idea was to give a certain amount of food aid in that circumstance. We didn't know at the time that David Beasley, the head of the World Food Program, would actually travel to Mozambique and would also make that one of the key areas. But at the same time, we weren't entirely certain of the level of the actual crisis that would evolve around famine, not around the coronavirus, but famine. Now, of course, that the Omicron variant has emerged, suddenly that nation is getting a lot of attention, which is attention that it could have gotten a long time back. 30 million people, half of whom are under the age of 15. An obvious case where potential for cultural optimism by taking a nation that was a manageable area to intervene with all forms of public health was not taken, although we did attempt to do certain things, and certain things have happened there. So besides the work on that particular area, Marcia writes for the Executive Intelligence Review. She's very involved in agricultural and related matters, and she's here to give us a report, not merely on what the committee's been doing, but the overall way in which this idea of public health involving food and clean water, sanitation, and so on is impacted by our policy approaches in the last period. So, Marcia?
Yes. Okay. Thank you, Dennis. And thank you and greetings to Helga and Ms. Ruggieri and Dr. Elders and Dr. Faget. And I'd like to start by just with the general picture and pick up what Dr. Elders always stresses about public health has to do with not just medicine, but food, water, power, transport, as she said. And I'll zoom in on the world picture on food, because you could zoom in on water or electricity, but on food, the location of the geography, you could say, of hunger internationally was increasing before the pandemic hit. Most of the people, millions of people, maybe 800 million going hungry in the world out of the nearly 8 billion people, are in Africa. But otherwise, these terrible situations are in Haiti, in the Americas, and elsewhere, and they are in Afghanistan, Yemen, as was said, and other places. Now, if you keep that map in your mind, look, however, in your mind's eye at what you could say is the map in the world of the grain belts. And the point is, not enough is being produced. The reason I say grain, because you could say, what about potatoes? What about something else? Most of the cultures of the world do depend on one or another of grains for their diet preference, whether it's rice or corn or maize, as we call it, or wheat. And in fact, if you take the nearly 8 billion people in the world and figure they need a half a ton of this, one of those grains, you should be producing 4 billion tons. The math is simple, or more. Do you know we aren't even producing 3 billion tons? And as I say, hunger before the pandemic was on the rise in the world, no matter how you distribute it, and it was wrongly maldistributed. People were deliberately left in poverty and hunger, but there wasn't enough being produced. That's the issue. There is no so-called natural disaster reason that we could not produce enough corn or wheat or rice. There has been an economic system based on just money and financialization and privatization run out of Wall Street or the City of London that's kept nations down. And in fact, the continent of Africa, with 53 nations, for its consumption of grain of all kinds, has become dependent on grain produced elsewhere. 40% of the grain in the last year or so that it might consume had to come from somewhere else, which is crazy. Africa is rich in natural resources. So that's the picture. What we need to do is increase production, and that sounds like a truism. But the point is, there has been a policy to suppress this everywhere except within China. Russia's a certain kind of case, and they've been producing sufficiently. But there's been a policy of international private powerful cartels that control what gets produced where and who gets to buy it or not. And so you have had farmers have been on the streets for just the right to produce. India, for over a year, it's coincidental with the pandemic, its farmers have been on the streets in New Delhi demanding the right to continue to be able to get a decent income and not have new agriculture laws imposed on them, which was September 2020, that would have created a condition where they wouldn't have any secure marketing for their grain and other products. And in fact, recently, it seems they won that fight, and there will be no such repressive agriculture new laws imposed. Germany has had farmers in the streets in the last month and for the last couple years because there are forces, monetarist forces, using the name of saving the environment to say agriculture pollutes and agriculture should be retarded. And so, for example, livestock growers like sheep raisers are told, you might live in a zone that we're going to save wolves and you're going to go out of business. I'm not exaggerating. In the United States, similarly, there has been a movement to say we should not have meat. Cattle growers should be shut down. So without going into the details, there have been fights in India by farmers, Germany by farmers, other countries in the world, here in the US, livestock growers as well. What does this add up to? This means that the dire need for food should be met in Afghanistan, Yemen, in Africa, in Central America and Haiti. And the fight for farmers to produce is a fight of all nations and citizens. And that's why, as the Committee for the Coincidence of Opposites is doing, we're working together in these different groupings, or the spokesman from Italy, as she just indicated, representing productive business and labor people in Italy. It is our joint mission to put in motion two things: the emergency measures that will take what food exists in the world, see that it's shipped where it's needed, for example, in Afghanistan right now in time, or other places, and meantime set in motion emergency measures for the credit, the bank loans, the contracts that will see to reemploying and sustaining farmers, businesses, and genuine independent production that's not under control of those financial centers and cartels that have created the conditions in which new viruses, which may happen, turn into epidemics and pandemics, which there's no need for. Now, in Mozambique, among the farmers and other doctors especially, and some young people and others who got together in recent months, there has been a friendship effort to both provide the means for food within that nation of Mozambique. It's a beautiful seacoast nation and has been subject to typhoons and hurricanes, and also terrorism in the north in the province of Cabo Delgado. And there is a need for almost 1 million people to have emergency food. So the World Food Program set up an office there in spring 2020. And meantime, the government is also working on disaster relief. So a combination of specially milled food rations from Louisiana, emergency water purification tablets manufactured in Wisconsin, medicines that Dr. Walter Faget and others in Washington helped collect, and Dr. Khadija Lang in California helped coordinate from Los Angeles area, have all been assembled for shipment to Mozambique to make the point we need the large-scale, multi-nation, major nation involvement in this kind of joint mission, because we can succeed. We can produce more food that currently is insufficiently being produced worldwide. We can take the immediate emergency measures, and in the course of that, we can figure out how to expand the infrastructure for future food production as well as hospital systems in every nation in the world. So that's a snapshot picture.
Okay, thank you very much, Marcia. We're now going to hear from, and I should just say also at this point, some people have been asking about questions. Yes, we will flash on the screen how you can get questions in for this, because there are a lot of them. And there's a lot of people that want to know sort of we're giving an arc of a process here, and they want to know a bit more about some of the background. Now we're going to hear from Dr. Randall W. Maxey. He's a nephrologist, kidney specialist based in Los Angeles. He's the past president of the National Medical Association. I believe he's president of that organization in 2003. And he's the founder of the Black Health Trust. He'll also be available. In fact, right after his presentation, I believe we will segue to the questions and discussion section. So we're going to hear from Dr. Maxey now.
Good day, everyone, and thank you for attending this wonderful global conference on issues of health. The title of my discussion is Economic and Political Clinical Basis of Health Disparities, and what are the realistic solutions? I am Dr. Randall Maxey. I'm past president of the National Medical Association, and I work in dialysis and health disparities. Black Americans and communities of color have higher rates of diabetes, chronic kidney disease, and obesity. People with these conditions are more likely, if they develop COVID-19, to get a severe case. Risk of COVID-19 infection can increase due to several conditions. One, living in highly populated areas or multi-generational homes where physical distancing is difficult, working outside the home as the tip of the spear, so to speak, as essential healthcare workers in retail, transportation, and food preparation. And many of the people in these communities of color have limited access to testing and appropriate medical care and treatment. Significant health disparities often exist between Americans of African descent and the general population. The ultimate expression of the health disparities in metabolic terms via diabetes, obesity, hypertension, kidney failure, heart, and cardiovascular disease. The root causes, however, are a combination of family history and genetics, socioeconomic status, and cultural conditioning, including lack of proper care, diet, and racism. We did a small area analysis of U.S. minority zip codes and congressional districts across the United States. And if you look at what I call the tragic smile across the lower, southwestern, southern, and southeastern borders of the United States, those are the zip codes that show up where the rate of renal failure, diabetes, hypertension are more than 50% higher than the average in those areas. And from a business standpoint, as a kidney doctor, this is exactly where I would propose you would build dialysis centers. And these are exactly the points where we need to strengthen our treatment of health disparities. What are these health disparities? One of the key ones that I see every day as a nephrologist, that there's a relationship between systolic blood pressure and end-stage renal disease. This was documented in a study years ago called Mr. Fit. And it shows that every time the systolic blood pressure goes up, there's a continual relationship between the incidence of occurrence of end-stage renal disease. We also know that people of color are not as compliant often. They're negatively affected by the coronavirus because of health disparities of obesity, diabetes, hypertension. And we are proposing and actually creating a system of remote patient monitoring and chronic care. This allows us to address the lack of access to medical care. Many of our people use emergency rooms and urgent care centers mostly, but we can create virtual care where you don't have to come to the doctor much. You don't have to go to an emergency room. We can keep up with the vital things such as your oximetry, your breathing. We can even keep track of your temperature, your weight, your blood pressure, and your blood sugar. We also know that we suffer from a lack of data, and there's a lack of cultural and clinical competence that we can address by having treatment guidelines effectively enforced by education of physicians in the United States and across the world. So in this virtual medical office, there's increased access care for COVID-19 and beyond. So our company is called Biometric Partners Healthcare Innovations. We know that with this virtual office and telehealth and remote patient monitoring, we can increase the compliance of patients with knowing what their blood pressure is. There's a big difference in your survivability if your blood pressure is normal, which is 120/80, versus 150/90. That's very important. Most people think it's okay for Black people and Hispanic people to have a pressure that high, but I guarantee you that is a deadly assumption and it's misinformation. So we have a hosted cloud-based network and infrastructure. This allows providers tools for quality care. It also generates significant revenue, and that's important. Right now, we know in Southern California alone, we spend almost $3.5 billion a year on healthcare. Almost none of that, probably less than 10%, comes back to our communities to address our problems of health disparity, both at the provider level and at the patient and community level. So this is very important that this be done as a business, not a charity. We know that this allows us to create a data warehouse. It allows us to provide community caregivers a network for participants, and we can share data as is necessary. And this can result in a lot of options for these patients, but more importantly, lots of revenue. And this allows us to address and solve some of the problems that react because we don't have the money to take care of the problems. Another issue, looking to the future, the near future, hopefully, we know that deadly pathogens such as COVID-19 and its variants, Delta, Lambda, Mu, and now Omicron, they're not going to disappear. We know that these respiratory infections affect our government. They threaten us at the economic level, our military, and the health of global populations. We now have all of these variants because we can't get vaccines or don't want to give vaccines to third world countries in Africa and South America. But until we make those communities safe, none of us are going to be safe. So we urgently need tools for fighting these respiratory infections, including rapid point of care tests, safe and effective vaccines, masks, and distribution to be done with that, safe and effective treatments, and global genomic surveillance needs to be done. We can take care of 3 of those. The rapid testing can be done. The rapid tests now available have a lot of false negatives and false positives. And it takes 2 or 3 days possibly to get the results, and the least one is 24 hours. We can get results in less than 10 seconds with our proposed network. In the genomic surveillance, if you have a cell phone, and most of us do, we always know that you're already being surveilled. So you might as well get surveilled in a way that can benefit you and other people of color. So we can have you tap into our online cloud, do the testing by putting a thermometer-like device in your mouth, pointing at your oral pharynx. In less than 10 seconds, you can know that you have COVID-19 or COVID-20 or whatever else is coming. It's not specific to COVID-19, but allows us to do that almost instantly. The science behind this, the mechanism by which the pathogen is identified, is done by Raman scattering. This was actually invented in 1928, and it allows scattered light to uniquely identify a specific pathogen by the wavelength that it fluoresces at. And when it fluoresces, it sends back a signal to our artificial intelligence, and we can identify and design the right frequency in nanometers that will kill that particular virus. So therefore, it cannot mutate in the time that we do that. What happens if you are infected? This is the RespirClear system, and it is a treatment system that uses nebulized solutions powered by mechanical ventilation and managed by artificial intelligence to deliver far UVC light irradiation to the lung airways. It gets all the way down to the alveoli. And it treats this in a matter of nanoseconds, and is done at such a minimum amount that it has no damage to the tissue of the lungs or of the body. We know that this far delivery system, by creating what is essentially a hologram, allows us to go around corners with the nebulization. It's basically a hologram, and we use what's called Tyndall scattering along with Raymond, and this allows us to kill the virus. So our future approach, which is unique, is that this allows us to develop a device that's handheld, enough that you can have your own device, or you can have a tip that's interchangeable, that you, your children, your family, your husband, your wife can put this in your mouth, pointed at the oral pharynx. There are sleeves that keep it sterile so that there's no cross-contamination, and we can have your results in less than 10 seconds. We put all this in our building that we're purchasing now in Los Angeles, and this is part of the solution that we're offering to health disparities and addressing COVID-19 and the underlying diseases that cause that to be more significant in communities of color. Stay healthy. Thank you.
And thank you very much, Dr. Maxey. Now we're going to bring everybody up on the screen for a discussion. And again, we'll flash across the screen for questions. We want questions for the audience, for the speakers, but we're going to first engage in a discussion. So let's see if we can bring everybody up. All right, we have Dr. Elders, Helga's there, Marcia, Dr. Maxey, hello. Dr. Faggot, are you there? I guess he's probably there. He's just probably.
I'm here.
Yeah,
I'm
yeah,
here.
I knew you were probably
Can you
there.
hear me?
Yes, yes. And we
Great.
also have Jason Ross. I want to have Jason, who is with what was called the basement team for the LaRouche organization and also for Schiller Institute. And I want to go to Jason first to get see if he has a response to any of what he heard, but particularly what Dr. Maxey was saying at the end. Is there anything you have on that or any other matters? Then we're going to open up and ask for general discussion. I'll go to Helga first, and then if other people have matters on the panel first. But you do have questions. We're going to leave the questions for a moment just to see if we can get a discussion among all of you and to see if there's any area that we've left out or that we think that we need to have addressed before we go to the general questions. So, Jason?
Well, thanks, Dennis.
I think you're muted.
Oh, let's see. Am I?
We're not.
You're okay.
Okay, now it's okay.
I'm okay. Okay, great. So, first off, thanks a lot for. It's a real honor to appear on this panel with these very distinguished speakers. I just had a couple of responses. Is that a lot of times health discussions stick with the very final stages of things, the point of care, and I'm really happy that we're taking this much broader approach to what's necessary to sustain a health infrastructure in terms of the basics of sanitation, which is something that's not about a hospital itself, but do you have clean water systems? Do you have sanitation systems? Do you have reliable power systems where people are able to keep themselves warm in the winter, cool in the summer, when that presents a health risk? And the fact that this also then leads into other things like, how is people's diet doing? This brings up issues of poverty, of health deserts, of transportation, of agricultural policy. Same thing with general health, even on the kind of exercise front. This is also a function of zoning, of transportation, of availability of parks, and also of public safety. If you feel that you can safely go out and get, take care of yourself. That's also an issue of economics. Do you have the time? How many jobs are you working? So, I think that the combination of these with some of the real amazing breakthrough technologies that we've been discussing, along with the basic public health ones, is a very promising approach. We've got the potential that, airplanes have done of improving ventilation. Some businesses have done, some schools have done, but this could be an opportunity for revitalizing healthcare, building up healthcare infrastructure across the world, and then even making investments and changes that could make us healthier even when there's not a pandemic, with just general better building health and this sort of thing. I think that the fact that we've got these new treatments that are being developed, the fact that we have monoclonal antibodies available, easier to get in some states than others, better publicized in some areas than others, but available. That we have antivirals, coming up, the Merck and then potentially the Pfizer one, which looks like it's more effective. The great breakthrough of being able to generate quickly mRNA vaccines, which is really a wonderful thing. And it's a real shame that, very plainly untrue things are said about them, like them changing your DNA, which just isn't possible. Because this is really the kind of breakthrough that can usher in a new era, I think, of being able to produce vaccines rapidly should something new arise. So, that's all I wanted to say. I think a lot's been said, and it's been wonderful, and looking forward to the discussion.
Okay, so let me go to Helga first for anything. Helga?
Well, I'm, very happy that we finally come to the point to realize that we need solidarity, of the human family, because if the, technological apartheid, which existed for a long time, has now basically, it has reached the medical side, but I think it dawns on people that, this lack of solidarity comes back to haunt you. And I would hope that out of this recognition comes an evolutionary jump, so to speak, a qualitative jump into a new era of mankind, where we stop to think in terms of selfish national interest or even, geopolitical interest, but really start to develop the idea of mankind first. I think this is, for me, the most important most important necessity to come out of this crisis. And I would I would really hope that, that pandemic and all the many people who have died, that was not in vain if we make that jump. And I would really hope that some people would agree with that.
Okay, let me just ask if there's anyone that has a comment at this point. Actually, I'm going to ask Dr. Elders because it was getting different questions, but your statement has been circulated. A lot of people are very excited about it and about the idea that you're calling for this dialogue, this discussion process where people sort of, from the standpoint of public education, start almost at square one so that people can understand what they're confronted with. Yeah, people have had a lot of experience with something, but actually they're not entirely clear with what. And I wanted to ask you to say something about why you think that element was either not well handled by the governments, but why you think that is the element that the epidemiologists, virologists, all of them at this point, they should take that as an initiative.
Well, Dennis, I think until we understand and we're educated and we're knowing what we're talking about, what we're doing, we obviously are going to make mistakes. I think most mistakes that we make, a few are not, are being deliberate, but most of them are really made out of ignorance. And I think as we educate ourselves, educate our people, educate all of the community, as they know better, they will do better. You just can't. Sometimes people may want to do better, and they may know better, but they simply do not have the resources to do what they know they need to do. And when you're hungry, you don't worry about whether it's got too much fat or the wrong kind of fat. You're worried about trying to satisfy your hunger. And I think that happens a lot. And I think we need to try and make sure we inform our people so that they can absolutely do the very best they can with what they've got. And we should try and make sure that they have the resources to do the basics. We aren't talking about being fancy and all of that. We're talking about just doing the basics. And to do the basics, they need to know how to do the basics. They need to know what to do the basics with. And so this is where I think the young people going out in the community to educate the communities about what they need to do and what they can do, and about going out to get the information that they need to bring back so we can make good decisions on the basis of what we have. And this is why I so strongly feel and so highly recommend that and information, and say that information is absolutely critical. We can talk about a good diet, but if we don't know what a good diet is, that's one thing. But if you're dying of starvation, a good diet is having food to put in your mouth, having something to eat. So I think that we need to make sure that we have the very basics, and then we try and make sure the people are informed on what they need to know. And when we talk about water, we're talking about clean drinking water. We don't want them to get diarrhea and die, and be getting dehydration and die. So there's just a lot of good basic health. And I'm always saying you can't, and Benjamin Franklin said long before me, you can't keep ignorant people healthy. You've got to make sure you educate them. And when we're talking about education, we're talking about the basic kinds of education. And so for that, I stress, and I feel that we have to make sure that in every country, every regardless of where we are, that we have the very basics of good food, clothing, and shelter. And then we want to make sure we have good basic health care, and that people understand and know how to take care of it and how to use it.
Okay. I have a question. Well, it's a question, but in the form of someone is referencing um, the South African discoverer of the Omicron variant in an article that was in the New Yorker. So I have to set this up, I think. So I don't know that people know, and they're asking to comment for the panel to comment on this passage. This was an interview with the New Yorker magazine on November 30th with Tulio de Oliveira, director of the South African Center for Epidemic Response and Innovation. Now, so this is the person who was able to identify the Omicron variant. And he said that his team was, quote, very surprised to see a variant emerge in a place with the highest population immunity in the country. I think that is one of the things that the world doesn't realize. Some people try to blame the variant on vaccine hesitancy. We have a problem with that, although potentially not as big a problem as the U.S. But people really thought we got out of the woods. Unfortunately, the new variant emerged, and it seems clear that it can reinfect people, which is potentially the last nail in the coffin of herd immunity, which one of your presidents famously talked about. And then the New Yorker asked a question back to him. But that the idea is can you comment on this? Does anybody want to take that up as to what is being referred to and what this means? I think we're asking the doctors here.
Can you hear me?
Yeah, I think, yes. Go ahead, Walter. Speak a little bit louder.
Yeah. Can you hear me now?
Yeah, that's better. That's good.
Yes.
Okay. Yeah. First of all, let's correct the record. The Omicron variant really was imported into South Africa, we think, because it was the travelers from Netherlands, Berlin. But I think, unfortunately, South Africa is being punished for being the first to discover it. But that's another issue. But I think I want to go back to what Dr. Elders was saying. There's another case in point. Doing the basics is very, very necessary until we do get the answers, as you correctly say. Be another week or two before we clearly know what's going on. But I think the fact that if you have the community health workers, as Dr. Elders is talking about, to demystify, so that it's even more important now, so that the population can be better informed, because they're getting so bombarded by so many conflicting facts. I think we're very fortunate to have Dr. Maxey on, and it's a good, we're working with LA, and I think Dr. Elders' vision has really resulted in DC now being number one in terms of comparison to other cities and how we dealt with COVID-19. And the fact that we do have community health workers, then that whole concept has been expanded and adopted by the mayor and the health department. It's been pretty well institutionalized, and we now have the curriculum at Howard. And we'll be working with Drew in LA. And it's very exciting to hear Dr. Maxey's sophisticated testing recommendations. And what's happened in DC, we were able to raise the immunization rate in Ward 7 and 8 from 4% back in March to now over 40%. It's very clear. If we take care of the disenfranchised or the more vulnerable, where the highest disparities are, then indeed the whole city will benefit. We have 0 deaths in DC. Well, we had 1 as of today, but 0 to 1 death. But I would, and we really hope to hear from LA how their implementation of the community health worker concept is doing. So, but in terms of the Omicron itself, it does appear to be more contagious, but we have no evidence of increased hospitalizations or deaths to date. But again, it's early. We do know it's in over 22 states in the United States now, but still we've not had any increase. Now there is one concern. It does appear that children are more at risk. And we did have one death from multisystem inflammatory disease reported a couple of days ago. That's of concern. But I think I'd like to hear from Dr. Maxey relative to Omicron in LA.
Dr. Maxey, I think you're muted.
All right. Thank you, my teacher. Walter's been my elder in my many years. And I'd like to give kudos to Dr. Elders. And she said that if you don't have education and knowledge, it's very difficult to be healthy. I think everything that's happening right now with the pandemic, the coronavirus, and particularly with the Omicron, are red herrings compared to the basic health disparities that exist in communities of color. And I view this as if we had adequate levels of nutrition, adequate levels of vitamin D, adequate levels of non-obesity, non-hypertension, we wouldn't be nearly so concerned about the pandemic per se. So we need to have good basic health education. The other thing I want to draw attention to that there's something called cultural and clinical competency, that the majority of our physicians in this country are not culturally or clinically competent, and therefore they don't know how to teach good health, to give good medicine, and the level of iatrogenic death and destruction is higher than police brutality. The other thing that I want to point out is that this level of health disparity and illness is planned. It's a result of structural racism. And you cannot donate your way out of it. You cannot be a do-gooder and get out of it, but you have to fight fire with fire. This is an planned economic thing to keep these Western nations wealthy. And I am very concerned that if we don't do that, if we don't do something that will go the route where you have private enterprise joining together. I mean, whoever heard of a company like Facebook being worth $1 trillion, or Apple being worth $1 trillion? They're more powerful than any government. And we need to take heed of that and use that model to get our own folks and our own self out of this. So we cannot just say, kumbaya, let's all work together. We have to have a plan, and we have to fight fire with fire. Nobody's going to create anything that's going to affect pharma without affecting money. And we have the insurance industry that's a huge model. If we don't do something at that level, it's all worth nothing. As to the medicine of it, I believe that before I'm going to worry about Omicron, I'm going to worry about Delta, which is the one that's kicking butt right now. And people ought to get vaccinated. People ought to have their boosters. They ought to still be masking. They ought to still be social distancing because this is going to be here for a while. But we do need to band together in economic enterprise. This whole world is dominated by the Western culture, and that's an economic model. And if you don't use that economic model to defeat the economic model, you're not going to get any place. Thank you.
Thank you very much. Does anybody want to comment on what Dr. Maxey said, other than Walter, who will, of course, have a comment? But I want to just ask that question first. I know that there's a comment that...
I'll just throw in one.
Go ahead. Go ahead. Go ahead, Marcia.
I just appreciate Maxey says and his map about where there's the far higher than necessary incidence of the hypertension and the complicating dialysis. I just throw in the last year, United States has 47 hospitals. New York City, Tennessee, California. This is part of that structural picture, Dr. C, I think, that if you, if people genuinely have information, this is crazy, isn't it? It speaks for itself to be shutting down hospitals at all and to do 47 of them when to take inventory and expand all the infrastructure and the food and reliable electricity and so forth.
Okay. Doctor, I don't think we can hear you. Are you muted again?
No, I'm not.
Okay, go ahead. Go ahead. We're having problems on this side. Go ahead. Fine.
So I heard somebody earlier comment on DC General Hospital. And I did part of my medical training at DC General Hospital when I was at Howard. And that was a community hospital, but it was good. It was culturally competent. When I go to the hospital, if I go to the hospital now as a patient, I take my wife, I take my adult kids, and they guard me from the doctors. Because today's doctors don't know how to take care of me or people of my color. So before I go to one of these hospitals, or before I have a patient go to these hospitals, I make sure that they are protected from the brand of medicine that we treat people with, which is basically Caucasian medicine. And medicine does not fit everybody the same. Our studies are done on white people. Our medicines are developed for white people, and they may or may not be the best for the people that we have. So we have to know what we're doing in a cultural way. People of East Indian descent metabolize drugs differently in their liver. People with hypertension metabolize and are treated better by certain drugs. ACE inhibitors are not good. Beta blockers are not good. ARBs are. So we have to have knowledge in depth and not just say go to a hospital where doctors don't know what the hell they're doing.
Let me just say also for people who don't know, and I think Alessia Ruggieri wants to make a comment about something that Marcia said. So we're going to, and I think we need the Italian translation for that. So the English translation. So we're going to go to her in a minute, but I just want everybody to know that DC General Hospital was a campaign that Lyndon LaRouche initiated back in 2000 and 2001. We tried to do a campaign for what was a better part of a year and a half to keep that hospital open. What was referenced by Dr. Maxey, what Dr. Faget knows very well, and Dr. Elders knows, is that we warned very clearly that if that hospital was closed, as other hospitals were being closed, that the later impact of that was going to be so far-reaching as to be, as we used to call it back then, genocidal. People sometimes overuse that term, but it was an accurate use of the term in that case. And much of, I think, what we should, and I just wanted to reference the campaign because people wouldn't know because it was 20 years ago. And so many of us are sitting here thinking about what we're seeing, recognizing that we saw it happening then. Yes, there are the particulars of right now, and there's particulars of what's happening internationally right now. But so I think we're going to probably be able to discuss a little later. The economic policies of this are exactly where the blame needs to be placed as to why these things can go on. So I guess what we're going to do is to go to Alessia, that we're doing right now. Okay, and so if we've got the translator ready, I guess we go ahead.
Ok, allora ringrazio Liliana Gorini per la traduzione. Allora, vorrei aggiungere qualcosa a quello che ha detto la dottoressa Becker, Marzia Becker. Io credo che la forza propulsiva per questa, a livello globale debba essere, come ha detto lei, delle attività produttive, perché le attività produttive, come in Italia ma come in tutto il mondo, rappresentano la colonna dorsale di tutta l'economia a livello nazionale ma a livello globale. Basti pensare che si parla a 360 gradi ovunque, in ogni dove, di transizione ecologica, transizione digitale, e in tutto questo si dimentica i settori più importanti per ogni nazione.
Excuse me, just want to know something. Excuse me. Are we doing a simultaneous, or are we going to hear her first and then Liliana will translate?
I can
Okay.
translate what she said until now, and then if she
Okay.
has more, she can
Okay, very
continue.
good. So
No,
let's hear
we're
what she
doing
said so
it
far.
consecutively, really, because of technical problems. What she said is that she thanks me for the translation. She wanted to comment on what Marsha Baker said about an alliance of productive forces and labor. And she thinks, as a trade unionist, that this is the key, because the productive forces are the very important factor at the global level to create the paradigm shift which is necessary. And there is presently, she said, a big talk about the ecological transition and digital transition, which totally forgets the productive forces, agriculture and labor. Ok, Alessia, prosegui.
Ok, d'accordo, grazie Liliana. Allora, le attività produttive, quelle più importanti, a partire dal turismo, a partire dall'agricoltura, sono state lasciate indietro in un mondo dove si parla, ribadisco, di innovazione. Non si può lasciare indietro settori che per nazioni come l'Italia erano la principale fonte di reddito per gli italiani. Non vogliamo essere...
Ok, concludi, sì.
Io credo che, come qualcuno già prima di me ha detto, da soli non si va da nessuna parte. Ecco perché ho accolto di buon grado l'invito della Presidente Helga Zepp-LaRouche, perché credo che un'interlocuzione a livello internazionale sia molto importante. L'appello, poi mi taccio, l'appello che hanno fatto i talebani è quello di avere un'alternativa alle coltivazioni di oppio, che prima, con l'invasione americana, era attività principale. Questo perché? Perché il mondo del lavoro e le attività produttive rappresentano l'unico modo di rinascita per l'Afghanistan. La stessa cosa è per il mondo che si trova abbandonato in una situazione economica disperata. Quindi tutto deve partire, la forza propulsiva deve partire esclusivamente dalle attività produttive con interlocuzione politica sana, e non si può prescindere dalle interlocuzioni internazionali. Bisogna fare rete, da soli non si va da nessuna parte. Ringrazio ancora Helga Zepp-LaRouche per l'opportunità.
Again, productive activity, in the case of Italy, in particular, agriculture and tourism, which have been abandoned and left at itself by the recent governments, are the key. They speak a lot of innovation, but they are not doing anything to create this innovation. As Helga Zepp-LaRouche was saying in her speech, alone, you don't go anywhere. We need cooperation internationally. And I was referring to the Taliban because they also were trying an alternative, were looking for an alternative to opium cultivation to replace opium poppy cultivation with agriculture. And this was actually started again with the British-American occupation. So as for Afghanistan, also for Europe and the rest of the world, as Marsha Baker said, the key is an alliance of productive forces, farmers, workers, and the labor. And in this sense, I endorsed enthusiastically Helga Zepp-LaRouche's call for Operation Ibn Sina.
Okay. Any response?
Well, yeah, I just want.
Hold on, Walter. Let Helga go, and then we'll come back to you.
Yeah, sure.
I think many people have noticed that, why there was a big upsetness when the Taliban took over Kabul, since about 2 months, the whole discussion about Afghanistan has completely disappeared from the public media. But we know from the people on the ground, that people are dying. Babies are starving to death. They are freezing to death because the winter has basically set in. And, I would really urge, to refocus on the question of starting a modern health system. And, I don't want to exclude other countries. We should do whatever we can. But I think if we fail Afghanistan to address what has been called by David Beasley, and I think also by Dr. Tedros, as the worst humanitarian crisis on the planet. If we as a so-called civilized society fail to address that, where it would be relatively easy to start an immediate emergency shipment of medical and food supply, I think this will be a test, because then if we don't develop the moral fiber to respond to something which is so absolutely gigantic and obvious, then I think we will lack the moral fiber to respond to other crises which are already mounting. And I don't even want to go into it right now, but I think we are sitting on a powder keg. We have a war danger. There are reports right now being massively escalated about the pending war between Russia, Ukraine, possibly the entire NATO. I don't want to discuss this now. I'm just saying that if we cannot mobilize the moral fiber to address what is clearly identified to be the worst humanitarian crisis on the planet, then I really think we need a wake up call and a mobilization. And I would hope that this particular forum will help to rekindle the concern for something which is so absolutely horrendous.
Okay, Walter.
I want to strongly really agree with Helga. When you say Afghanistan, you got to think about Yemen and Haiti. Fortunately, we have an effort which might be a good model. We just sent some supplies to Mozambique. And I think if we could really add on to that, improve the entire healthcare delivery system in that instance. Agricultural needs are very key. And we really have the team assembled for that kind of effort. So perhaps some of the other areas can benefit from lessons learned, or the coalition that we're building. Because I do know that in Afghanistan now, you do have surrounding countries trying to assist as much as they can are allowed. So I just submit that the Mozambique project that Sheila has been so instrumental in initiating would be a good model going forward.
We're trying to get up on screen, but we don't have him yet. Dr. Denton from the Physicians Against Nuclear War. And momentarily, we'll wait on that for a minute. Let me just ask and see if anybody else on the panel has any comment on what has been said so far. Jason?
Yeah, I mean, I just want to say that I think the biggest picture here is the goal of crushing poverty everywhere in the world. I mean, and an opportunity for this absolutely exists right now, because so many of the issues that we come up against come from having insufficient resources for people to have the time to take care of themselves, to be able to know that they'll be able to afford going to a doctor. I mean, poverty is a crushing issue in the world. And I think that the absolute discrediting of the Anglo-American system in the world, in the eyes of the world and in the eyes of people living within those countries, like right here, the absolute discrediting of our institutions, or many of them, I think opens the opportunity to say that a new paradigm truly is possible, and that many countries are seeing this through the efforts, for example, of China, which has been exporting infrastructural, industrial know-how, offering something that's different. And if we don't crush Wall Street, and if we don't crush this green effort to implement an ideology that says that human beings themselves are the problem, we're going to have a very hard time achieving full success on health issues if we try to do that in toleration of an ideology that says human beings are pollution. That's going to make it very difficult. And the green transition that's pushed for is an extremely expensive proposition, expensive by virtue of being physically unproductive, so that you're putting more people in a situation where you say, can I afford heat? Can I afford to go to a doctor? Can I afford to buy that healthier food? Because, what is my power bill? What is my energy bill? What am I looking at in terms of gas prices, inflation generally? So it's all building up. And I think it really calls out for that global perspective of a new paradigm that the Schiller Institute is calling for.
Let me comment if I could. First of all, in a collegial way, I 150% disagree with you. That I believe we have an excellent model. It's just that the only people allowed to play the game are white people. I think if we opened up the playing field, that gives us the largesse to have money to supply the rest of the world. I worked for a time in Zimbabwe, for a time in South Africa. And while South African natives, black people, were starving, white people were taking out trillions of dollars of diamonds and golds, etc. When I thought that Mugabe was so powerful, or even the first black president of South Africa was powerful, it was still the economic interest by such people as Tiny Rollins, the Dutch, the Belgians, and the British that were taking all the money. I don't think it's any better when you have the Taliban killing people, when you have Chinese killing people. So I don't think it is just the Western, the Anglo, but is the way that the species of Homo sapiens wiped out all the other human-like species before, so that we're the only ones left, as opposed to the other species that were intelligent before. It's our nature, and we need to understand that. And if we can harness that nature to keep everybody alive, I think that's it. And I think the systemic thing that the Western thing has done is to generate capital, but just the underlying part of it is just treat us white people and nobody else. That's where the danger is. But there hasn't been this kind of economic development, this kind of health development, intellectual development in any other system. And I think that is where it is. Right now, nobody is doing anything right for us. So I think we ought to divorce ourselves of the current system and say, let's work by the economic rules. Let's create our own trillion-dollar companies to feed our people, and not look at it that we need to stop economics, stop the big corporations. Let's hijack them to our benefit.
Okay, now we have a meeting. So Jason, are you ready to respond to that?
Yeah, I guess I don't see the point of the disagreement, or I think we may mean different things, and there's a bit of this going on there. So I'm not sure. I mean, I see a difference between an actual business that does something and the increasing financialization of the economy. There's a big difference between a business, building a business that hires people, that produces something useful, a good, a service, provision of healthcare. I mean, that's one thing. It's something entirely different when you get more and more of the productivity of the economy essentially siphoned off into purely financial areas. So if you think about the trend that we've seen with overhead in health insurance, for example, which is one of the big things people point to in proposing Medicare for all, is that you'd be able to, if you slice out that profit that health insurance companies make, slice out all of the bureaucracy that's entailed, where you go to your doctor's office and half the staff is dealing with paperwork with the insurance company. This is something where, does that business make money? Yes. Is it economically productive? No. I also must say that I think that although many of the or most of the people at the highest levels in the British financial establishment, in Wall Street, in Silicon Valley, have more reflective skin tones. I do not believe that white solidarity is guiding their actions. There certainly can exist anti-Black racism, that's true. But the idea that I think you're painting a bit of a broad brush, if I'm understanding you right, in imagining that there is a sort of a white solidarity involved, when on the contrary, there's an enormous disparity between the financialization of the economy and the productive economy. I think that there are most people in the United States of whatever appearance or historical immigration background, what have you, are seeing their economic lives become more and more difficult. That's not true of the people at the top, but for most, it's true across the board, because we are allowing a policy where the Fed is producing enormous amounts of money, driving huge levels of inflation, and not investing on a national level in the kinds of infrastructure that we would all benefit from. High-speed rail, new power systems, water treatment systems, transportation, etc. I mean, that's really got to be our objective. What can we do as a nation? And I think that if we give up on, I'm not saying you're proposing this, but some people do. They believe that, well, you know what, maybe we're not going to change it on that national level. Maybe I can do more good through my private business pursuits. And for some people, that's true. You may do an awful lot of good through private business. That happens. My focus, and I think that a necessary focus that if it's overlooked, we're going to lose, is going to be how are we going to change government policy so that it's actually supporting the general welfare of people instead of Wall Street, instead of a tiny minority focused as much in the city of London as it is in what seem to be the power centers here, Washington, Wall Street, Silicon Valley.
Okay. Briefly. I had a patient.
Hold on for a minute, Dr. Maxey. I just wanted to say one thing so people know. So we have several questions that are now beginning to come in, and I want to just make sure that people know this, because the whole point of doing this is to have this conversation, as far as I'm concerned, not the particular thing we're talking about, but the difficult conversations. And we're now starting to get questions that reflect that. So I just wanted that to be known so people know, and we can have that dialogue. So just before you answer, let me ask this question, because I'd like to see if anybody else has a response to what you said. Maybe nobody has, but does anybody else want to respond to Dr. Maxey before he responds to Jason? Okay, because we'll take his response, and then I want to bring out some questions. Right. So go ahead.
Okay.
I'll be very brief.
Point of personal prayer. I just want. Okay.
Oh, go ahead, Walter. Are you responding to him, or?
No. I just want to point of personal privilege so that the two sides can discuss it from this point. The sick care system versus what Surgeon General Johnson Elders recommends as wellness and improving health care literacy and prevention. I think that's a key part of it. The hospitals closing recently due to business decisions. $1 billion parking lot is more important to that chain than taking care of the patients. So if the two sides could really look at it from that perspective, I'd appreciate that as well.
Okay, fine.
I yield my time to Dr. Maxey.
Lest I be misunderstood, my patient was a guy named Dick Gregory for 40 years before he passed. And people thought he might have been a bit prejudiced against white people. He said, no, I'm not talking about you. You're not a white person. You're not really white, in my estimation, unless you can go outside and make a phone call and the stock market drops by 3% based on what you did. The rest of us are just regular people. The thing is, we're not included at the top of the pyramid. That's what I think will make a difference. I do hardly think that you're right. We need to deal with all those things. We just need to be at the table. If you're not at the table, you're on the table.
Oh, okay, and just in interest again of disclosure, Dick Gregory was one of our subscribers for many years back in the 1970s. He also had some serious contentions with us a little bit later, about just before he died. My wife had quite a discussion with him in 2015. And we always appreciated Dick because the thing about Dick was he always told you exactly what he was thinking. That's exactly the kind of thing we want to do in these conversations. And we appreciate what everybody has said to get us to this point, because now things are beginning to come in that we thought were going to begin to come in. So here's a question, and I don't have who this is from, but I'll just read it. There have been reports of abreactions to the vaccine and reports of deaths from the vaccine and reports of ineffectiveness of the vaccine. One question is why people aren't tested before being given a vaccine to make sure there will be no conflict with other conditions that they may have. Before a doctor prescribes a medication, they usually have to know what other drugs you are taking or any other medical conditions you might have that would indicate you should not take that drug. Why is this not being done with vaccination for COVID? Doctor permission does not seem to be a requirement to get the vaccine. Anybody want to take that?
I'll take the first shot.
Okay.
With the mRNA vaccines, they are essentially an effort to make 3D printing of a vaccine. It is not something that contains real biological material. It's a code, it's a computer code. And this computer code is allowed to increase your immune response. There have been few, if any, documented cases of people dying from the vaccine. We, however, do know that on any given day, an insurance actuarial table will tell you X number of people between the ages of 18 and 45 are going to die. X number of people of this color are going to die. And so far, to my understanding, there has been no group of people outside of that curve that have died. For sure, the vaccines do have allergic reactions, and you cannot know with something new that you're going to have an allergic reaction, but you should get in a situation where an allergy can be created. We do know that there's been some controversial side effects. That is in a very small number of people that there have been thrombotic events that have occurred, but we don't know if those thrombotic events wouldn't have occurred for real. We do have a former chief medical examiner in the city of Washington, D.C., who spoke to me and said when he does autopsies on people who have died from COVID, they have clots in every area of the body. And that's because this virus does affect the endothelial system, which does affect blood clotting. So there are some few complications, but they are extremely small. There has been nothing to show people that I understand that anywhere nears the danger of the virus versus the danger of the vaccine. And I believe much of the misinformation is made to make Black people, people of color, people who don't have good educations confused and not avail themselves of something that can save their life and their family.
Okay. Anyone else? Or we're going to take that?
Just super briefly, that I mean, the question seems to presuppose that such a test exists. If it doesn't, then what are you referring to? I mean, you do fill out a form before you get a vaccine, and it asks you if you've had bad reactions to vaccines before and some other questions. As Dr. Maxey just said, we don't always know who's going to have a bad response, but what's the test?
And I think if we really look at it, we know that of the millions of vaccines that's been given, the reactions there are reactions to whatever. You know, I always say when we talk about medications, I always tell people all medicines are poison. At least they poison some system. If they didn't poison some system, they wouldn't be any good. They wouldn't be medicines. They wouldn't really do any good. And so there are a few people in the world that are going to have some reactions, but I think that the vaccine is far more important to me, as I see it, it's far more important that all people get vaccines, and there is some risk, and we'll have to take that risk, and we have no way of knowing if those certain people will get that risk. But I think the most important thing we can do now is to make sure that everybody, all people, get the vaccines. And most people who are not taking the vaccines is not related to allergy, not related to, it's more related to things that's really not facts. And so we need to be encouraging and education. And I think that we need to be encouraging all people except those whom we know are allergic. You know, if we know somebody's allergic to eggs or some component of the vaccine, we know, and they tell us, well, we know not to give those people maybe the vaccine, but I think everybody else should really get the vaccine, and we should be promoting that if we want to stop this virus. And and I think we keep going off down into the small holes where we aren't going to get to where we need to go. And where we need to go is to make sure that all people all over the world, everywhere, that can be immunized are immunized, and as soon and as quickly as we possibly can get it done.
Okay, I think we have up on screen, I see him up on screen. Is this Dr. Richard Denton? Is that you? So that's you. North American co-president of the International Physicians Against Nuclear War. And he has a comment. So, and a question maybe also, but let me just give you the microphone, let you go right ahead.
Thank you very much. There's an excellent discussion going on here this afternoon. And I want to thank you very much for organizing it. So thank you. I fully agree with you that what we have shown with COVID is that we have a global problem that needs a world solution and not a national. And my other colleague there was talking about the differences with the black people being disadvantaged, and I fully agree with him. I think that what we need to do in the world is to work together, to dialogue together, and look after personal security, which was being threatened by the pandemic. It's being threatened by the climate change, and is also being threatened by nuclear weapons. And we need to dialogue together and to address these as personal security issues on a global scale through discussion, dialogue with other countries around the world. I think we need a strong central government, such as the United Nations, although there are certainly problems with the United Nations currently. But I think that is the way to go. Rotary, I'm also involved in, has shown that through negotiation with governments that we can eliminate polio. There was just 2 cases in the world this past year, both in January and none since, one in Afghanistan, one in Pakistan. Rotary is currently working in Afghanistan with the Taliban to create truce days and are being supported by the Taliban military so that they can go around and vaccinate children. We did this during the civil war in Sri Lanka. We created a truce day that was negotiated. In Africa, we have done this by dispelling local myths about vaccines, by again getting the help of governments which really did not have polio on their agenda, and but we through Rotary were able to get it on the agenda and vaccinate people, and also go out to the rural areas. So I think vaccination is the way to go. The problem is here in Canada, we're doing about, I think, 84% or more are now vaccinated. I just got my third booster this morning. But in Europe, it's about 66%. In Africa, it's way less because they simply don't have access to the vaccines. And it's ironic that vaccines are developed on specimens from the third world, but we don't get the vaccines back to the third world to get them vaccinated. So I'll leave it at that. Thank you very much.
Yeah, thank you very much. Does anybody want to
Yeah.
respond at this point or? Okay, very good. So we have a question. I think this is primarily for Helga, but it may be the case that others may have something to say about this. This is from Dr. Luckner Mercredi, a cardiac surgeon and president of the Foundation for the Reconstruction of Haiti. He has a pretty straightforward question, which is what should I do so that Haiti can be involved in the projects outlined in the Schiller Institute plan for Haiti and for a modern health system in every country? How can the projects which the Schiller Institute is promoting be implemented? So I think it was directed at you, Helga, and then if there's anybody, I don't know, Marsha, if you worked on that program for Haiti or not, but if there's anybody else that has any comment.
Well, I think we are actually on a good way to make this whole approach more known. We need more volunteers. We need people who do, for example, we have now this excellent initiative by Dr. Elders, the letter directed to the virologists to basically do what the governments have not done sufficiently, which is this education so that people know. I mean, right now you have an increasing number of people who are willing to be vaccinated, but you have also a very small, I think small, but hardcore, very radicalized people who think that vaccination is a plot against them. And as I said earlier, they mix a lot of correct criticisms, but giving it the wrong the wrong explanation. And by opposing vaccinations, they actually do the job for the people who they think are making the plot against them, which is depopulation. That needs to be urgently discussed. Not only the health aspect, but also the confusion about who is doing what to whom. For example, we have now started to spread the letter of Dr. Elders in many countries in Europe. We are also doing this in Latin America. But I think the most important thing would be that people volunteer to be active in this effort, so that we can multiply our activity and create actually a public pressure on the governments to do what they should have been doing the whole time. So maybe we should, after this forum, we should contact you in person and work out, what can be done between us.
Okay, I'll return to questions. There's a question, I don't know that this is from New Jersey, but the question states, there is currently a study being done in Rutgers University, on the neurological effect of COVID, and other studies are being done. When COVID first hit, there was a concentration on the symptoms. Then it became clear the symptoms got more and more involved. Now there is no such discussion. Are we really communicating what is or is not known about this infection? That's the question.
Dennis, I want to defer to Dr. Maxey on this, but again, as Dr. Maxey mentioned before, the virus attacks the endothelium. And I know we've had some discussion on Black Health Trust. So I think Randy's prepared to answer some questions on that too.
The question was about the neurological effects of COVID.
Yeah, it's
Right.
basically, it's essentially
Right.
saying, that earlier there was a concentration on symptoms, then it became clear they were more involved, and there isn't enough discussion going on now about it. And they're asking what is and is not known about the infection.
There are a heightened amount of discussions going on. In fact, NIH just gave a huge grant to NYU, State University of New York. In fact, we're hosting a major conference next year on the post-acute syndrome, because that's where a lot of the neurological effects are, even from subclinical infections with COVID, that it can affect your neurological function permanently, or at least for years. And many times this even shows up in children as learning and functional disabilities in that way. So there's a lot going on. And we are putting together that kind of conference. We had one conference about 6 months ago, which is going to be published by Springer Verlag. So there's a lot of work going on, and we're looking now for people doing cutting edge research in the neurological effects of post-acute syndrome, which is COVID. But you can certainly contact us at the Black Health Trust, and we do have a number of recorded presentations on that issue.
Okay. I'm sorry. I'm looking for. There's a question that came in. Well, I'll try to paraphrase it. Don't have the exact wording in front of me, but this is for the trade unionist Alessia from Italy, and the question. Okay. Now I have. Although you are not a medical person, you have and you made an important statement concerning Afghanistan and the processes there. And I agree with what you have said in response to Marcia. How do you think that the other nations of the world, as well as the United States, could activate people who are in trade unions or working families to become more vocal in their involvement in this cause? So that's directed to on at this point. Okay, well that question's there, and so people just know, and if we get her back on, we can go back through that. Okay, now there was something that sorry about this. It was just a okay, fine. So now this question is for Helga, and the question is, now that you have this committee and that we are having this conference today, Dr. Elders has said this. I had put forward the idea again about the youth groups, the idea of youth groups, and trying to just make this out. Okay, I understand what they're saying. So let me just say how it works. Now that we've had the meeting today, and Dr. Elders has put forward her proposal, how do you propose that this expansion with respect to youth being involved, who are not trained and do not know much about medicine, how would that happen? I think that also, Dr. Faggett, you may want to say something about this, because I think you've been dealing with that down in DC. So Helga, maybe we go to you first, and then we go to Walter.
Well, I think that the question of young people being involved in this effort is extremely important, because you have right now, I think, a very big disorientation of young people thinking the world is going to end, because they're being told that the world ends in 12 years or in 18 months, or it stopped already a week ago. I mean, the human mind is capable of developing solutions to any challenge. I think this is what makes us unique. I think we are the creative species in the universe. And I think the thing which young people right now need most, apart from a clear vision of a positive future is the development of their emotions, the passion, the compassion. And I think, we are in a cultural crisis which we couldn't even touch upon, which, you have drug addiction. You have in the United States more than 100,000 people dying of overdose of drugs every year. It's one of the 10 most common causes of death. So it's a major disease. And, you have just the other day, a young boy of 15 years goes around in Detroit and kills 3 people, injures many more. I mean, all of these are reflections of a tremendous disorder in society. And I think the question of giving young people a job where they can do something useful, originally we wanted the Committee of Coincidence of Opposites to partner with, let's say, have clinics and faculties in the United States partner with faculties in Africa, in Haiti. This became very difficult because the way the COVID, is infectious. But nevertheless, it could be replicated, even if it's via Zoom that such connections are being made. For young people to learn to love humanity, to give their contribution, to be compassionate with other people in need. I mean, this is, in my view, one of the most important tasks, because if young people are all addicted to stupid video games, if they learn to kill in these video games with greater efficiency, they kill off their compassion. They become crippled human beings. This is what Schiller was talking about when he said the most important requirement of his time was the development of compassion, of empathy, of the ability to love other people. And I see that this whole present culture of video games and related electronic device games around, that this is killing the normal emotional maturity of people. And to give young people such a job, which is both necessary and meaningful, is the best way to develop their character. So I would really hope that we can take the example which Dr. Faget will now speak about and replicate it in as many places as possible.
Right. Again, we've been fortunate. The Schiller Institute Coincidence of Opposites Committee really has stimulated much interest in DC. The youth are very excited about learning how to deal with chronic disease. And again, the initial effort was to demystify COVID to the community, and it's really worked. I think we have developed a curriculum now at Howard University, which will be collaborating with Drew in LA. And it's a very extensive curriculum with an emphasis on how you demystify some of the terminologies and increase health literacy in the community. And it's been working very well. We've had decreased vaccine hesitancy. As I said, the immunization rate at Ward 8 went from 4% to 40% since March. Now, the still a disparity. It's only about 66% in citywide and 40% in Ward 8. So this disparity still exists, but we have 0 deaths. So it's another example of by taking care of the disenfranchised, of the most vulnerable in the population, the entire population has benefited. And I know Dr. Maxey has had a lot of community work kind of concepts there. And I don't know if he wants to add. We will be working more with California, as well as the Mozambique effort will be an opportunity once we're allowed to bring the team in. We'll have youth to include medical students, dental, social work. And it's some of the high school students from Ballou are so excited to be working with medical students that look like them. And we've gotten a very increased interest in health careers from this as well. So I don't know if Randall wants to expand on the
before we do
LA.
But hold on, let me say a couple things before we do that. We have 2 more questions which are clearly pertinent. We may have a third that I haven't yet had transmitted. and I want to make sure I get these in. We're also coming up on time, so I want to begin to get us to the point that we can do final statements. So and actually there are three questions. I'm going to say one to you now, Walter, not for you to respond right now, but for you to think about, which is that someone is asking that you had mentioned in the original presentation, Guinea, or the idea what would have happened if you had a variant of the virus and it had been in Guinea, where there is sort of a convergence between, from what they understood you to say, Marburg virus, Ebola, or potential for a convergence of Marburg virus, Ebola, and other conditions. So they just wanted you to clarify that and tell them what they had to say. But I have something I want to direct to the doctors, all of you, and to Helga as well. This is a report. Well, there's Jose. Jose's reporting about a prominent professor in New York. He's an epidemiologist. Has stated that he thinks that COVID or COVID-like viruses are going to mutate into something as severe as a 50% fatality rate under certain conditions. And you'll get high transmission. And the reason this would happen is because of the poverty. Now, Roderick Wallace is this person I know, and he's been writing about this for a long time. He wrote a book called A Synergy of Plagues. And he's talked about the idea of the burning down of the Bronx, the problem of the drug transmission of disease through drugs, the AIDS problem, et cetera, and that this has created a kind of synergy, as he puts it, where you have to deal with public health. If you don't do that, you are inevitably going to reach a kind of what he also calls bubonic plague 2.0. And so you can't do anything about this. This will not care what color you are, won't care what your economic status is. What happens then? Okay, so that's the thesis, and that's what was presented. So who'd like to start? Or do people just want to think about it first?
I think that's where we are now.
Okay.
I mean, and we have the vaccines, we have new treatments coming up. I don't think I think we've gone about as far as we can, but we know the solution. The solution is to get people vaccinated and to get people's basic nutrition and health status up. And we know that there are new treatments coming along. So I don't think there's anything revealing about his statement is true.
Mm-hmm. Okay. That pretty much what people want to say. That's it. Okay, fine.
Right.
So let's move.
Well, I mean,
We know what
I'd
to
just say
do.
it
We
would
know
be,
how to do it.
And it should just be done, right? Okay, that's okay, fine. So Walter, they want that clarification. Can we
Yeah.
get that from you?
Absolutely. The Ebola epidemic was an example of what it takes to really contain something so it does not spread worldwide. And the same kind of effort needs to continue. We spent about $2 billion to really bring in the security and all the resources needed. Right now, there's Marburg virus as well as Ebola has popped up again in Guinea. And when I say Guinea, that means it's already in Liberia and Sierra Leone, there in West Africa. Can you imagine the COVID Omicron variant combined with those two in that area? So I think it behooves us to really contain, do what we can to improve immunizations, improve nutrition, decrease poverty, all the things that are needed to really keep it contained as much as we can. So we would do well, I think, to get some political will to provide the resources needed to properly attack it. So this could be very a catastrophic event if you had those three co-occurring at the same time in West Africa.
Okay, right. So it's just basically a call for what we're calling for. All right. I think what we're going to do at this point is go to final statements. There are a few other questions, but they essentially cover much of the area that we've already gone over. So I think what I'm going to do is ask Marcia, we'll start with you, and just give us anything that you want to respond to and what you've heard, or any further comments that you'd like to make.
Okay, it's come to my mind two points that, as right at the beginning.
No problem with your audio. Is that your internet connection, or you? Oh, that's what it is.
Oh, I think it might be the internet connection. If
That's a little bit better. Go ahead.
Internet connection, okay, have to be stopped because of the mission. I thank you all, and we're going to keep fighting. But I will say this: idea of the common interest of us all, life is safe, I think means that the right to production, people at your age, is so associated with that. And that's what's been taken away. You take a priority like Afghanistan. I just mentioned a very good thing has happened, that are at odds with each other, nevertheless, which has wheat to send to Afghanistan, can cross over Pakistan's land and do that. But about this, follow that up.
Marcia, it's hard to make you out. I mean, what you were saying was that a good example of the coincidence of opposites is that between India and Pakistan, there had been a dispute about getting some wheat from India to Afghanistan. They figured out how to resolve it, partially with Afghanistan trucks came down, I understand, and that was allowed to pass through. And you were trying to give that as an example of, go ahead.
Yeah, what I'll do is just because of the transmission problem. But if it's followed up with wheat from Kansas, one of the biggest places in the, what we should do is we can be very deliberate, all of us and new volunteers and activists around the world. And I'll leave it at there because of the transition problem. But that's the point, I think.
What you can also do, Marcia, by the way, is you can also do a text or something if you have something to say, which I can read, when people can then, know what your final thoughts were, if there's anything additional. Okay, Dr. Maxey, let's go to you.
Well, I thank you for your invitation for me to present and to discuss. And I think this is a good effort. I urge people to work together, but be very practical and work through the economic system. Let's just put us at the table.
Okay, very good. Jason?
I'll also like to just really express my gratitude for being able to participate in this discussion. That's great getting to join the Schiller Institute, Dr. Faggett, Dr. Maxey, Surgeon General, elders. And I think that the way that we address questions, including things on vaccine or other disagreements in a respectful, thoughtful way, is the kind of approach that will be effective at helping address the public health education that Dr. Elders called for in her statement, which is that, being able to address people's questions, their concerns, wherever they came from, address them, sort of directly and respectfully, is a way to develop trust and help people think things through. And again, I'd just like to express my thanks for being able to participate in this discussion.
Okay. Walter, we're going to even give you a chance to say something else.
Content.
Go ahead.
Yeah, I just am so grateful for Helga and Dr. Elder's leadership and to be part of this. I think it's a good example of how good consensus can come out of conflict as well. But I think we have the potential, I think, for really combating this effectively. I just one point I want to make. We also need to be aware of what works. Some of these traditional efforts that Africa's probably doing a lot better in some instances than the United States, and how they've been containing the virus. But I know in Ethiopia, they have some local remedies and traditional approaches, which we need to learn about because they've been doing something right. So I think it could be a learning experience for us as well. And I think the fact that South Africa was the first to identify the Omicron, they need to get credit for that, not punished for that. Thank you.
Okay, very good. Dr. Elders?
Well, I think, first of all, it was thanks for putting this group together. But the reason for doing it, the main reason, as we work together, we need to listen to what's going on out there so we'll know, so we can learn, so we can lead. You can't lead if you don't know. You can't teach what you don't know. And you can't lead where you won't go. So I think that we're really trying to learn so we can lead. When we talk about our young people, most of what they need is leadership. And so we have to go and find out what they feel that their community needs, teach them what they need to do so they can go and be about doing that. And I think, as I said, we have the resources in this world to do what we need to do. We have the know-how to do most of what we need to do. We just need to put it all together and get the leadership and get everything together to move it to serve all of the people that we need to serve.
Let me just say that we got, and we're not going to, this is a question we'll not all take up now, but this is a request which we just got from a farmer, 24 years old, from Kansas. Would the elder doctor leaders be willing to have informal conversations with youth on the successful fights in the past with yellow fever and other diseases? We don't get any history. We don't know what the precedents are, and we need that. So that's a request. And I think I can say that the answer will be yes. And we would, of course, ask that maybe all of you would, be in touch with us about that, and we can set something like that up. So, Helga, we're now at the end. So you have something that you want to say to everybody in summary.
Yeah, I mean, I'm coming out of this discussion with mixed feelings. I'm both hopeful and worried. I'm worried because we have been talking about this for now many decades. That the condition where you could have the emergence of old diseases and new diseases, which could create a situation of a dark age. That danger is clearly there because you cannot just look at the health aspect. We have a hyperinflation in the transatlantic world, in energy prices, in food prices. We have a threat to agriculture. A lot of farmers are extremely concerned that they may not be able to keep producing in part because bad rules, bad conditions for their farming. This is a very wide field to be discussed, but food supply is not secure. We have a famine, a world famine of biblical dimensions. So I don't think we have it yet. I think we have a incredibly complex danger to the present civilization. I touched upon the war danger earlier without being able to elaborate on it. So I'm really still I don't feel safe. I don't think the human species is safe at all. So that's my worrying part. My more optimistic part is that I have seen a lot of goodness, especially among doctors. Also, right from the beginning of the pandemic, there was a much larger exchange of information, medical information among doctors from many countries. So I think on that level, I think there has been actual progress in the human behavior of people. And I think, so I feel this tension. So I think the only way to resolve the tension is to do more, to find more people who join our effort. And I want to thank all of you because, this has been a very productive process which had many phases, but I think we are now really in earnest about to expand it way beyond the United States, and I think this will be a very important part. So I want to thank all of you, and I'm also happy to be, in such company, and I thank all of you for helping out and be part of this. So I hope to see you very soon.
Dr. Walter Faggett, Dr. Randall Maxey, Marcia Baker, Dr. Jocelyn Elders, Jason Ross, Helga Sepp-LaRouche, and to our Italian colleague, Alessa Ruggieri. Thank you all for being with us. And I think what we're going to do for the close, thank you, Walter's applauding himself, and I guess everybody else. and I guess what I'd like to do is just by way of closing us out, refer to a question that came in actually. And this had been addressed to Helga, and it's a useful one for everybody to think about, I think. In January of 2020, before we had recognized the COVID disease, Russian President Vladimir Putin called for an urgent summit of the 5 founding countries of the United Nations: China, France, Russia, United Kingdom, and the United States, which are also the permanent members of the UN Security Council. In a particular speech he gave, he said, "Destruction of the past and the lack of unity in the face of threats can lead to terrible consequences. We must have the courage to be straight about this and do everything in order to defend peace. I think an example could and should be set by the founding countries of the United Nations, the 5 powers that bear special responsibility for the preservation of civilization. We have discussed this with several of our colleagues, and as far as I know, have received a generally positive response to holding a meeting of the heads of state of the 5 permanent members of the UN Security Council: Russia, China, the United States, France, and Britain, and said we could hold it in any country, et cetera. Now, as everyone is aware or should be aware, there is tremendous tension between the United States and China, the United States and Russia at this moment. At the same time, all of 2020, Helga Sepp-LaRouche and the Schiller Institute and others supported this proposal by President Putin, thought it was the right thing to do, and particularly thought it was the right thing to do after the announcement of the coronavirus crisis. It would seem that the idea of the Committee for the Coincidence of Opposites, and specifically the idea that Dr. Elders has put forward concerning this notion of a world forum, a world symposium, a living symposium, a breathing, active symposium of all the people in the world who have something to say, or epidemiologists, virologists, and so on, and then those who are affected who also have something to say, so that a real understanding of how the world as a whole can move forward and survive and prosper is essential. We should remember that John Kennedy, confronted with the Cuban Missile Crisis in October of 1962, was able by June of 1963 to propose to the Soviet Union a joint manned mission to the moon and other exploration of space, even though those countries had seemed about to go to nuclear war 8 months earlier. So this idea of the coincidence of opposites, of working together for higher purposes, is something that this committee has pioneered, and it's something that you've just heard. You've also seen a small instance, obviously, of disagreement in the panel itself. That's exactly what we're looking for. We're looking for the fact that in the world today, more than anything else, people speaking to one another about what they are actually thinking and not speaking from presupposed and pre-established agendas, particularly of those who mean humanity no good, located in various locations around the world, like the City of London or other places on Wall Street and so on, that instead of that dominating the thinking, the idea of dialogue and the idea of moving the world ahead by our efforts to do something. As Dr. Elders said, everybody can't do everything, but everybody can do something. And the one thing that everybody certainly can do is think. That's what we ask and invite people to do. That's the point of the Committee for the Coincidence of Opposites. We believe that out of that thinking and deliberative process, humanity will not only survive, but humanity can prosper, and we can certainly defeat any pandemic, including the pandemic of ignorance and hostility and hatred, which is the more important and most important pandemic that humanity faces today, for which we know the clear antidote. That is love, that is trust, that is knowledge, that is cooperation. So on behalf of the Schiller Institute, I want to thank everybody for joining us today. Please begin to work with us, join the Schiller Institute, become a member, become active with us, and respond to Dr. Elder's call in every way that you possibly can. Thank you.